everyone, welcome to my channel. Today we have another step 2 question for pediatrics. If you would like to see more step 2 questions, please like and subscribe. A 16-year-old girl is evaluated for worsening pain in her right hip and upper thigh. The discomfort began about a year ago and initially occurred only during sports activities. Over time, the pain gradually became more frequent, eventually limiting her during routine walking. During the past several weeks, she has started experiencing pain even while resting or sleeping. Over-the-counter pain medications have failed to relieve the pain. The patient has a history of sickle cell disease with prior hospitalizations for painful vaso-occlusive episodes affecting her chest, neck, and extremities. However, she explains that this pain feels different from her previous crisis. On examination, she reports uncomfortable and walks with a mild limp. Movement of the right hip is painful in all directions and range of motion is noticeably decreased. Sensation, muscle strength, reflexes, and distal pulses are all normal. Laboratory studies reveal chronic neurocystic anemia with no leukocytosis. Which of the following is the most likely cause of this patient's symptoms? A. Primary malignant tumor of the proximal femur. Well, bone cancer could potentially lead to lower extremity pain, but the thing is, we do not have any evidence to suggest that this patient has uh, bone cancer, so we cannot necessarily go with A. B. A slipped capital femoral epiphysis. Well, this could happen due to obesity and other external traumas, and it could lead to lower extremity pain, hip pain, groin pain. But the issue is, it's very common among younger teenagers with open growth plates because it's very reliant on the growth plate. So I'm not very comfortable with B. C. A stress fracture of the femoral neck. Well, a stress fracture of the femoral neck could potentially lead to these lower extremity pains, but we do not have any evidence to suggest that there has been a trauma that has caused this. So I'm not very comfortable with this answer choice. D. Septic arthritis involving the hip joint. Well, septic arthritis, basically the bacterial infection, could lead to lower hip pain and lower extremity pain, but the issue is with that you would expect to see fever or maybe at least see increased white blood cell counts, which is not something we are seeing here. So D, not the best answer choice. E, post-infectious reactive arthritis. Post-infectious reactive arthritis is likely after gastrointestinal infection or genitourinary urinary infections, but we have no evidence to basically prove that the patient has had this kind of infection. So I'm not very happy with this answer choice. F, avascular necrosis. Avascular necrosis actually can happen due to sickle cell disease, and this patient has had sickle cell disease in the past, and avascular necrosis can lead to hip pain as well as groin pain, and it could also limit the range of motion. So I would say among all these answer choices, F is the best answer choice. Thank you very much for watching this video, and don't forget to like and subscribe. Thank you.